The next chapter that we'll be looking at is chapter 2, where we'll be talking about the legal and ethical aspects of drug administration. This will be the first chapter that's on test 2. So make sure that you read this and follow along. Once again, only about 10 pages in this chapter, but lots of important information. And then your ATI pages 12 to 15 also will give you some of the same info. So once again, we've got the learning outcomes on the first page of chapter 2 and all these different definitions that you'll have to recognize. Now, as you know, as nurses, we have many responsibilities for our patients and many people looking over our shoulders. So we have to answer to 3 sets of guidelines when we are working under our nursing license. And the first one that we work with all the time are the facility guidelines, the policies and procedures of the facility where you are practicing as a nurse. Then we are under the guidelines of our particular state. The Board of Nursing of that particular state determines those guidelines, and they can be found in what document? Yes, you're right, the Nurse Practice Act of your particular state of Tennessee, or wherever you end up moving to and working after you graduate. And then everybody who works in healthcare has to abide by a certain number of federal guidelines. This is the federal government, and even though the federal government tends to stay out of things in many cases that are covered by the state, there are still certain guidelines that we have to follow that the federal government has set up. One of the areas of federal legislation involves what drug categories a medication falls under in the United States. So any kind of med that is given that is considered a drug or a medication, meaning the FDA has their hand in it, are either controlled substances, prescription or legend drugs, or over-the-counter medications. Now, we do not count alternative treatments and herbal medications because they have not been overseen by the FDA. They slip under the wire of oversight by the FDA because they can be counted as supplements, nutritional supplements rather than medications. But for something to be considered a medication, it has to be tested and approved by the FDA and determined to be both safe and effective for human use. So the 3 drug categories, controlled substances concerns drugs that are abused fairly often, can be dangerous, and require a prescription. And an example of this would be narcotic drugs for pain, or maybe benzodiazepines as sedatives. Many drugs besides this category are considered prescription drugs. They still have to have a prescription by the doctor, but nobody's really abusing them. Nobody's going to be standing on a street corner trying to score, a bunch of penicillin or a bunch of birth control pills. Doctor has to write a prescription, or another healthcare provider, and they can be bought easily in a pharmacy, but nobody's really going to be abusing them because they don't have that kind of effect. And then the most widely prescribed, or not prescribed, the most widely taken drug is probably going to be an over-the-counter medication. These are drugs that patients can buy without a prescription. On page 12, there's a memory jogger in orange. It's very important to always read your memory joggers in case you see those again. And this explains the difference in physical or psychological dependence. Now, the term dependence is one that can be a little bit confusing because many times people associate dependence on a drug with addiction to a drug, and that is not necessarily the case. It's a very fine line between the two, but generally it's not crossed. But it's very common to become dependent on a drug, both physically with your body and psychologically with the brain. And so the two differences in psychological and physical dependence are explained in the memory jogger on page 12, and I do encourage you to look carefully at that because no doubt you'll see it again. Let's look at page 13. We're going to park here for a few minutes and look at continued legislation that is overseen by the federal government. And this very important legislation is the classification of controlled substances in the United States. And this takes up the entire table 2.1. And we see that we have a list of Roman numerals. So we do use Roman numerals every once in a while. And the first place we use them, as you can see, is in the controlled substances schedule. Now, the lower the number, the higher the risk of addiction. So your Schedule 1 drugs are the first drugs listed here. These are drugs that are considered to be very highly addictive. They don't really have an accepted medical use in the United States for treatment. And we'll see the little twist to this in a minute. There is usually a lack of accepted safety for use, even under medical supervision, and generally you can't get it with a prescription. And so examples are, there's about 80 of them, which are considered to have no real acceptable medical use and are considered to be harmful and have a great addictive potential. And yes, I do see marijuana here in that list. And the reason marijuana is still in the list of controlled substances is that August 11th, 2016, the FDA reaffirmed the status of marijuana to be a Schedule 1 drug. Even though in many states marijuana is legal for medical uses, or in some states a small amount of marijuana is okay for your own personal recreational use, the FDA still affirmed it as a Schedule 1 drug. This is the reason why it's very difficult to get any really good, solid, double-blind, placebo testing of marijuana, and why in many cases we have an idea of what medical conditions marijuana is good for, but not a lot of studies to back that up. So as often happens with medications, the situation has changed and the laws have not kept up with it. So very strict laws were passed against marijuana back in the early part of the 20th century for a variety of reasons, mostly financial. These rules have remained in effect, and so marijuana is still considered to be a Schedule 1 drug.